October is Breast Cancer Awareness Month. That has groups everywhere pushing to raise awareness about the disease, usually by covering everything from football players to yogurt lids in a signature bright pink. But behind the cheerful colors is a devastating disease that affects roughly 12% of women in the United States. Advancements in science and improvements in access to health care are putting a dent in that number. In this Newsmaker interview, I spoke with Margeaux Lippoldt of the Oklahoma Project Woman and Dr. David Berger, Medical Director of the Integris Comprehensive Breast Center. Margeaux, how common is breast cancer right now? Just not for women, but also for men?
I think it's definitely a common thing that we need to be aware of in our society. I lost my mom to breast cancer. Her mom has had it since then. I have a good friend whose father has had breast cancer, so it's just something that we need to be aware of.
What are advancements that have been made recently in breast cancer prevention and the search for the cure?
Well, as far as prevention goes, the technology that we've been using is still decently common and been around for a couple of years. We obviously are getting, with the advent of digital mammography, which is quite old at this point in time, we've got a good tool. There's been introduction of tomosynthesis, which is a 3D view of looking at the breast. That is still under sort of investigation. The FDA hasn't really issued a reimbursement for it in the United States yet, so that is something that's still ongoing and maybe a good tool for us in the future, but is still under investigation here.
What should women do if they are concerned about their chance of breast cancer and the possibility that they are carrying that gene?
Well, first off, make sure and talk to your doctor, know your risk. Okay, if indeed you have a strong family history, share that with them so they'll make sure that you're getting the proper screening. Starting at age 40 though, the best thing that everyone can do is make sure to start getting your annual screening mammograms. That's your best chance of catching a cancer early so that we can get you to the proper physicians to get that treated and taken care of. And if you're at elevated risk, once again, talk to your doctor, come in and talk to a professional like myself that deals with breast cancer, and then we can make sure that you're getting the additional screening modalities you need, like an annual MRI, making sure your clinician's seeing you a little bit more frequently to make sure that we catch that cancer as early as possible.
Margeaux, your organization is working with women to try to make sure that they are getting mammograms and taking some proactive approaches. What are you doing?
Oklahoma Project Woman is a statewide comprehensive program that provides free breast health care to uninsured, low-income women. So women that don't have the financial resources to get the screenings themselves, we provide that through contracts with 30 hospitals in the state and their corresponding radiology, surgical, pathology groups. So we provide a continuous care to the patient from beginning to end. Ideally, we would love to just give them a mammogram and they go on their way, but unfortunately, people are diagnosed through our program. So,
the Affordable Care Act guarantees access to mammograms. How important is that?
That's a great step. Unfortunately, there are always going to be uninsured Oklahomans. There's always going to be that gap. People just have a hard time making the copay. The Congressional Budget Office, their recent estimate is that 1 in 10 Americans will still be uninsured after the full Affordable Care Act has been implemented. So that gap is still going to be there, and we will still be here to fill that void.
Dr. Berger, is breast cancer actually more than one type of cancer?
Sure, there's various types of cancer that can occur. We have the most common, which is the area of the ducts. You know, you think of the breast as being an organ that is involved with making breast milk, things like that. That's the areas where you think of cancer coming from most commonly. However, there's additional types that can occur. But luckily, the tests we have to screen for the mammograms, and then if indeed you're high risk in MRI, all those things can help identify that. So all the cancer types we can see.
Where's the research heading?
Well, gene marking, obviously being able to tell what the cancer will respond to, all these things are areas that we've got great growth in and really have a better knowledge than we ever had before. Once again, we've talked about the most important thing, which is just people making sure and getting those screenings done. You know, that's where our growth and our benefit can occur in society, is making sure everybody comes in and gets that screening mammogram.
Margeaux Lippoldt, Dr.
Yes.
David Berger, thank you very much.
Thanks so much.
Thank you, sir.